Moving on with this pancreas presentation, learning objectives. Should be able to explain the possible location, orientations, and relationships and physiology of the new transplanted organ. To review the protocol, review the methodology and temporal protocol of Doppler ultrasound of patients' transplanted pancreas. Pancreas transplant. The pancreas is procured from the donor in a variety of ways. Depending on the operative needs, the second portion of the duodenum containing the ampulla ovata is recovered with the pancreas. There are three types of transplants. The SKP is the most common, being about 78% of all transplants of the pancreas and the kidneys. The PAK, which is a pancreas after a kidney transplant, is second to the SKP transplants at about 16%. The least frequent used transplant is the PTA, and that's a pancreas transplant by itself alone. SKP, simultaneous kidney pancreas transplant. Who is a candidate for SKP transplant? Adults who have kidney failure because of type 1 diabetes. The pancreas does not make enough insulin, a hormone that controls the blood sugar levels in your body. The transplanted pancreas can make insulin and correct this type of diabetes. To become active on the transplant waiting list, you must be 18 years of age or older, have both type 1 diabetes and kidney failure. Type 2 diabetes are not candidates but can have a renal transplant if they're in kidney failure. There are actually three types of transplants. Its frequency is only about 7% of kidney and pancreas transplants. There are several steps before a person can receive a transplant. There's an evaluation process. Part of it is a blood type testing. If the recipient is A, the donor type must be A or O. B, the donor type must be B or O. O, the donor type must be O. But if you're AB, you can have A, B, AB, or O type. The second test is tissue testing. Human leukocyte antigens, HLAs, perfect match transplants, have the best chance of working for many years. Serology testing is also done for viruses such as HIV, human immunodeficiency virus, hepatitis, and CMV, cytomegalovirus, and congenital CMV. Here in the U.S., about 45% of American adults are registered organ donors. Alaska registered donors are around 80% of the population. That was in 2012 compared to New York, which was 12.7%. Bones, skin, heart, valves, and corneas can be donated within 24 hours of death after cardiac arrest. Typical storage time are 30 hours or less for a kidney, and less than 12 hours for a pancreas or liver, and less than 6 hours for the heart and lungs. Currently, 121,678 people are waiting for life-saving organ transplant in the USA. Of these, 100,791 await kidney transplants, and that's as of 1/11/16, a year ago. The median wait time for an individual first kidney transplant is about 3.6 years and can vary depending on health, compatibility, and availability of organs. In 2014, 17,107 kidney transplants took place in the U.S. Of these, 11,570 came from deceased donors and 5,537 came from living donors. Every 10 minutes, someone is added to the national transplant waiting list. On average, 22 people die each day while waiting for a transplant. One organ donor can save 8 lives. I created this animation to demonstrate what it is like to have a SKP done, where you have the kidney transplant and the pancreas transplant at the same time. Starting with the transplant kidney from the donor, the kidney is taken with the artery and vein and ureter attached. The donor kidney is placed in the recipient in the left iliac fossa. The renal artery is attached to the external iliac artery, the renal vein is attached to the external iliac vein, and the ureter is anastomosed to the bladder. Here's some abstract information FYI. Case study abstracted 270 renal patients. 177 cases anastomosed to the end of the internal iliac artery. 125% developed vascular complications. 38 of these patients subsequently underwent allograft nephrectomy. None died from hemorrhage. In contrast to this case study, 83 patients' renal vessels were anastomosed and end to the side of the iliac artery. Vascular complications in 14%. 32 patients underwent allograft nephrectomy. 8 severe hemorrhaging, which 5 of them were fatal. Now, with the pancreas transplant, the most commonly used technique for transplantation of the whole pancreas is the systemic bladder drainage, consisting of a duodenal pancreatic graft with a duodenal vesicle anastomosis. The transplanted pancreas is then placed intraperitoneally within the right iliac fossa of the recipient. The vasculature used to connect the donor pancreas to the recipient is obtained from the donor in the form of the iliac artery at the bifurcation. It is then anastomosed to the SMA and the splenic artery, and that is attached to the external iliac artery. The portal vein is anastomosed to the IVC unless the pelvis insertion is used. Then it is attached to the external iliac vein. So what is your role as a sonographer? What is expected of you, and what do we need to do to give the doctor the information that they need?